Welcome back everyone to part 3 of a 4-part series. We're talking about hip osteoarthritis and mobility exercises. Today we're going to talk about the hip external rotation, or the seated crossover. It's really important. It's a functional movement that a lot of us do when you're tying your shoes or putting on socks or anything for that matter. And a lot of people with hip osteoarthritis, they absolutely cannot do this. It's way too painful. They can't bring that leg up and it causes a lot of pain in their groin. So we want to stretch into that or mobilize into that safely. Like we talked about in the other parts, again, you're going to feel some discomfort and some pain. Totally safe. It's normal to feel this at this stage. Just make sure that you keep that pain to a minimal 1 or 2. And optimally, when you get to that place where you don't feel that growing pain, you're going to feel a stretch in your hip, your rear end, kind of in the back side here on the side. So what Jessica's going to do is, we'll say that this is her side with arthritis. She's going to cross that foot over this knee, just use your hands and bring it right up. So if she had mild arthritis or no arthritis, she'd be able to pull that up no problem, and sometimes not even use her hands. But once she gets there, she'll move this foot underneath her, and then she's going to sit up really tall through her lower back. And when she does that, when she leans forward, she's not pushing this down. She's just kind of hooking her hands there to pull herself up into tallness, if you will. And then she should feel that stretch on the back side of that right side. Now, again, this is if you don't have moderate to severe arthritis. This is no problem for her. So what we're going to do is show you how to use a strap. So if you're really limited here, how to start kind of breaking that down and working into that. So let's bring that back down. So if you can do that though, and it's still a mild amount of pain, feel free to do that without the strap, and you're going to want to start doing that for 15 to 30 seconds, multiple times a day. Just a snack here and a snack there. So she'll take a strap. This could be like a sheet or a long blanket, but she's going to grab a hold of that. And what she's going to focus on, we're going to break this into 3 parts. So the first thing is she'll kind of stay leaning back, almost against the chair. So in this beginning, feel free to slouch. I know it's tough when you hear a physical therapist say slouch, but it is okay in this situation. She'll straighten this knee out, and she's just going to focus on this, pulling this shin up this leg. So she'll let that knee fall out as much as it can. Walk her hands down here a little bit more. And she's keeping her elbows in tight like that. You don't want to be pulling up. Show them what bad would be. If she was pulling up like that, you can see how that's going to hurt her neck. So she's keeping her elbows in. She's going to pull it up to there, and then right there, that could be very painful to the hip. So she'll back that down to maybe right there. So you want to feel maybe a 1 or a 2. If you're feeling nothing, you're probably not going into the capsule or into the hip range of motion enough. So a little bit of discomfort, totally safe. And then she'll hold that for maybe 10 seconds, and then she'll keep tension on it, but she'll just let it come back down to right about there, the safe zone, where don't let it all the way down, take it off, because then you're wasting time and you have to get it all back on again. So she'll go right back up. Now she'll keep doing that for a couple of weeks, maybe even a month, until she's getting more and more flexible in there, and this knee's kind of starting to fall out a little bit more. Once she's able to pull that all the way up to right above her kneecap, and she'll hold it right there, then we'll keep her leaning back. And what she'll start to work on now is bringing this foot underneath her, just maybe to there. That might be enough to push the knee and the foot up so she feels more tension, more discomfort there. She'll work on that for a couple weeks. Once she gets to the point, and after 10 seconds, she can keep her foot there, but just move that bottom foot back out, and then she'll work that again like we did with the strap. So getting the leg to cross over is the first step. Getting this foot to get right underneath that knee is the second step, and then from there she'll use the strap, or if she can even use her hands here, she'll pull herself starting to come back up in that tallness. And then she'll stay there for, yeah, that's perfect. You can have one hand there, one hand the strap, and then eventually you get to the place where you don't need the strap at all. Now again, this process, if you have moderate to severe arthritis, you may never get to this point before surgery. However, you must try, because the benefits of working on that hip mobility and that tight joint capsule are enormous. It'll really open you up to feel better with walking, just day-to-day activities of daily living, getting dressed, just all those simple basic things that we take for granted. So she'll hold that again. Once you get to that point, I like to start to hold that longer, maybe 30 seconds to 60 seconds. But again, staying at that 15 to 30 is okay too. And doing that 3, 4, 5, 6, 7 times a day, just whenever you get a chance. I also think it's important that you do this on both sides, because it's a good stretch that people without hip arthritis do. Athletes and active people want to kind of do these stretches throughout the day anyway. And you get also a real-time comparison of how your hip with arthritis feels compared to your hip that doesn't have arthritis. Thank you very much.